This video will demonstrate bag mask ventilation of the patient. One provider at the head of the patient. The pre-hospital care provider kneels above the patient's head, providing manual stabilization of the patient's head and neck in a neutral inline position with his or her knees. After the insertion of an airway adjunct, OPA or NPA, the mask is fitted over the patient's nose and mouth and held in place with firm downward pressure while keeping the airway open. This can be accomplished by placing the third, fourth, and fifth fingers around the mandible and applying slight upward pressure. Wrapping the thumb and first finger around the mask at the mask and bag attachment point, forming a C. Either adequate hand pressure is used or the bag is pressed against one's own body, for example, the thigh, to squeeze the air or oxygen from the bag and into the patient's lungs. The patient's chest is looked at to assure adequate rise with each breath delivered. One provider at the head of the patient inserting an OPA. OPA insertion should only be performed in patients without a gag reflex. Position yourself above the patient's head with one knee on each side of the patient's head with slight inward pressure. After insertion of the OPA, encircle the mask with your thumb on the nose part of the mask and your first 2 or 3 fingers on the jaw part of the mask. Hook your little finger or ring finger and little finger under the lower mandible to keep the mandible elevated and to avoid any loss of the seal with movement of the chin. The patient's chest is looked at to assure adequate rise with each breath delivered. 2 providers with bag mask. When 2 providers are available to assist the patient's ventilations with a bag mask, one provider maintains the head and neck with neutral inline stabilization while holding the face mask in place. The first provider kneels above the patient's head and maintains manual stabilization of the patient's head and neck in a neutral inline position. Their forearms should be placed either on the ground or on their legs for added stabilization. Once inline stabilization is achieved, the first provider will also keep the patient's airway open with a trauma jaw thrust maneuver. The face mask is placed over the patient's nose and mouth while the mask is held in place by the first provider with their thumbs on the lateral portion of the mask while pulling the mandible up into the mask. The other fingers provide the manual stabilization and maintain a patent airway. The second provider kneels at the side of the patient and squeezes the bag with both hands to inflate the lungs. The patient's chest is looked at to assure adequate rise with each breath delivered.